Campaigning's already started.
All ready? Good evening, ladies and gentlemen. I'd like to call this June 9th, 2023 meeting in the Eureka Springs Hospital Commission to order at 6:01. You all got a copy of the agenda. I have two corrections that need to be made to the agenda. It has to do with the approval of the minutes. We have, instead of April 17th, it should say March 20th and May 15th. We have two sets of minutes because we didn't have a quorum. Does anybody else have any changes or additions to the minutes? If not, I would entertain a motion to approve.
Make a motion, we approve the minutes. Oh, I can, but I didn't approve.
Sure you can.
Okay, I did.
Do I have a second?
Second.
Any discussion? All those in favor say aye.
Aye.
Okay, let's start with the approval of the March 20th, 2023 minutes. Do I have a motion for an approval of the March 2023 minutes?
So moved.
Second?
Second.
Any discussion? All those in favor say aye. Any opposed? Motion carries. Now could I have a motion for approval of the May 15th, 2023 minutes?
So moved.
Do I have a second?
A second.
Any discussion? All those in favor say aye.
Aye.
Any opposed? Motion carries. I don't see any members of the public here, so we do not have any public comments, but I keep forgetting this, and I have it written down here in big letters. Could I have a roll call, please?
Oh, Barbara Dix, Vice Chair.
Kate Trotter, Commissioner.
Dave Carlisle, Commissioner.
Judy Gigi.
Sharon Doremus, Commissioner.
Angie Shaw, CEO.
And I am Kent Turner, Chair. Sorry about that. I'll get that in the right order one of these days. Committee reports. I'm going to report the Finance Committee has started meeting again hopefully on what will be on a regular basis. We don't really have anything to report to the Commission. We've just been working on a bunch of things that need to be taken care of and addressed from a policy standpoint. But I am very glad to see that we're back in action, at least with the finance report. We can kind of keep up to date on things that are going on in the hospital from a financial standpoint. To give you an idea of the types of things we've discussed losses that we've been occurring on the clinic and how they're going to remedy those. And I say we, it's primarily the staff, and Barbara and I just kind of listen in and throw in our 2 cents. So we're trying to take all of the areas where we don't have profitability and do things that will either make them profitable or get rid of them. I have to say that Cynthia is doing a really good job of following up on details of the different things that we're doing. To give you an idea, we were losing about $20,000 a month on the clinic, and that's just not sustainable. Hospital expansion, we're still waiting patiently, and my patience is growing thin on state funding, but we do have to wait because we have to understand that we did have an administration change at the beginning of this year. I did have a phone call last week that told me that they were still working on the COVID money, or the ARHP money. And so that tells me that we're not out of the running. Probably if we don't hear anything in the month of June, I'm going to go back to Washington and start working in that direction again also, because the longer it takes, the more expensive this project gets. Next on the agenda is the CEO report. Angie?
Okay. Well, you already talked about the financial meetings we had. That's kind of where I'm going to begin as well. On the operational level, the administration team, so Cynthia and I, along with our CNO and just different directors, have all been meeting individually, reviewing contracts to ensure that they are still pertinent to our operations, making changes where we can, renegotiating where we can as well. You brought up the hospital clinic. It was a hard decision, but we've decided to close the clinic at the end of this month. The closing date is an effective date of the 29th. The last day they will see patients is Monday, the 26th. We are looking at what we'll do with that space. The clinic right now has been being utilized by specialists, so we'll continue that with the dermatology and the urologist. And we will be looking at other specialists that we might be able to bring into town to see patients once a month or twice a month, depending on how they want to set up contracts. I know that we've been approached by some cardiologists that are looking for some rural healthcare space, so we'll look more into that. I'm hoping that these changes will assist our bottom line as well as improve care, bring in the specialists that we need. On a positive note, our patient census has increased through the ED. It's kind of the beginning of tour season, and we are definitely seeing that. Our admits have also slowly increased, inpatient observation, and as well as swing bed. You'll see a slight increase on our financial report in those areas when we review that. Our new case manager started the end of May. She has spent her time improving our admit policies and procedures, meeting with staff, re-educating on admits, and including the medical staff on that. We brought in, like I said, a new case manager. However, in June, we are seeing some changes in staff as well. Some key staff members, our HIM director, her last day was Friday, so that is an open position that we are actively searching for her replacement. And then at the end of this month, our AP clerk will also be leaving as well. Her husband is a teacher, and he took a position, I believe, in Little Rock. So she is not going to stay. I did receive a word on Friday that we will be getting our Alvarez and Marsal report soon. That was the audit that was completed back the end of March through the Arkansas Hospital Association. Once I receive it and review it, I will present it at the next meeting. And this was also for some grant funding, so we'll see what happens there. And we're still continuing to work with the auditors from Forbes for the financial audits for 2021 and 2022. They're still asking for information, usually about once a week now. I think we have an estimated completion date for that audit to come back to us around August or September. And I know Samantha had sent out her marketing report, just some of the highlights on there. The main highlight is that Samantha has been meeting with the directors, especially our outpatient services such as surgery, speech therapy, lab, radiology. She is putting together a marketing plan for them to get their information out to the community as well as healthcare providers in the area to let them know what services that we are offering testing and how quick we can get their results back to them for their patients. So hopefully that will bring in some more outpatient testing for us. We have not really seen a drop in that area, but it needs to grow back to where it was pre-pandemic. So I think that's about it. I have any questions for me?
Questions for Angie?
When's the last day of the clinic?
The last day they'll see patients is Monday the 26th.
June.
June
Thank you.
26th.
Any other questions? Thank you, Angie. I see Bill's name on the screen, but I don't see his face. Is Bill here?
He said he was able to get on.
finally, after about 3 months. So that's about all that you're missing out on the video. Looking at our cash position, this kind of goes along with the reviews that Cynthia and Kent and Barbara and Angie are doing, and our cash position eroded $414,000 from the end of April, cash in the bank. At the end of May, it was $5,165,000. Since June the 1st, this being the 19th, I have transferred $260,000 from the commission money market to cover payroll and AP, accounts payable. My plan, this is officially, I believe, my last month, isn't it, Angie? And with that said, next month, when we close out June, we're going to do a 6-month interim cost report to find out where we stand with Medicare and Medicaid and see if there's any monies that we are owed. So we're going to be looking to that to see, we need to know where we stand. And Medicare is asking for a look. There is a chart that I have of the hospital money market. This does not include the commission money market. And you can see that the drop off to at or near zero, I think I have it down to like $7,000 now. But you can see that last month we were at $1 million was November of last year. So we've had a steady cash drain each month from that point forward. Looking at our revenue, to go along with what Angie pointed out, I direct your eyes to May. You'll note the med surge on the first line, 31,000. Down a couple of lines, you'll see swing bed, 15,000. And then our observation utilization was down near the bottom of the page. It's 476, $80,000 as opposed to 64,000 last month. So increases in the people in the beds areas for sure. Our revenue versus last month is an increase at 2.9%, and compared to last year's 5.7%. We are, for the hospital, we're $463,000 year to date revenue decrease from the prior year. The average monthly revenue is $1,254,000. So you can see the last 3 months we were above that average, and the first 2 months of the year we were below. Looking at our income statement, yes, we are showing some losses for the month. $235,000. Our spend, which would include debt for the month, was $778,000, and our net revenue for the month, $523,000. When I looked at net patient service revenue, $472,000, that's only 36% of the gross revenue that we are reflecting for the month of May. And we look over under the actual year-to-date column, $2,403,000. That net patient service revenue is 46% of the total patient revenue year-to-date. So it's possible that our allowances against our accounts receivable were approximately $130,000 overestimated for the 1 month. Our average spend per month, as I calculated, is $757,000. So that's kind of the, we have to bring in that much to break even. And hold on just a second. Let me divide that by 5 right quick. And we're bringing in about $592,000. So you can see the decrease per month, or over expenditure of $165,000. So yes, we do make some corrections in our spending patterns on a go-forward basis, review all the contracts. We've seen over time, we tend to at a hospital, we tend to let those get away from us. And the train is coming through, so I'll continue to talk for a minute. I don't think y'all will be able to hear it. I have a good microphone, on here, but it's only covering, my headset only covers one ear. So I get the train, and it depends on who's riding the bell in the train, whether it's the good guy or the bad guy. Typically, the bad guy comes through at 3 a.m. Looking at the balance sheet, the last page of my presentation, you'll note that the actual end-of-month cash on an accrual basis is $5,123,000, a decrease of $146,000 from last month. Looking under the liabilities, you'll note that accounts payable was up $48,000 from the prior month. That's just a timing difference. There's nothing to be alarmed about there. And then the employee compensation accrual, and again, that's a timing issue, $33,000 higher than last month. So that's my report that I have for you tonight. Are there any questions or further concerns?
Any questions for Bill?
No.
Doesn't look like it, Bill. Thank you very much. Good
All right,
report.
guys, thank y'all.
Okay. I have on the agenda Cerner Financial and Operating Systems update. I'm going to leave that. That'll be on the agenda every month because I just want to make sure that we stay on top of that. We probably don't have much. I assume we got the contract signed?
The contract's been signed. I believe we have a meeting with them at the end of this month.
Okay. But we just need to make sure that we stay on top of what's going on with that so we know where we're at.
If I'll interject, my hospital at McGee is, they are progressing nicely with their Cerner conversion, and so far they're very pleased with the professionalism of the Cerner group. So I'll just pass that along.
That's good to know. Thank you. Okay, so we've come to the point in the meeting where do we have any commission comments?
I don't.
Okay. Chair comments. I know we get worried about financials. I've spent my life in the world of finance and business and see all the ups and downs. I will be honest with you, I am not overly concerned. I think we're going to see, I think we'll see some changes as we go on. I think we're doing the right things from the standpoint of evaluating policies and procedures and costs at the hospital. I think we'll continue to do that. I would just, from my perspective, I would not get, even though we've had to close the clinic, which I know we're trying to make sure that people understand why that's the case. I think it's the right thing to do at this point in time. And we may need, and as Angie's doing, looking at some different alternatives as opposed to a clinic. We do have other clinics in town. So I am still very optimistic about the prospects of the hospital. I still get good reports from people that come to the hospital. If we were getting bad reports all the time, I would be more concerned. But the fact that we're providing good service, I think, is the thing that is the most important. And we're in times that we've never been in before. None of us have ever experienced what happens after a major pandemic and where people have been healthed to death. And so consequently, I think you're going to see things start to calm down and settle out. So from my perspective, I still remain extremely optimistic, even though it's been a tough couple of months. So. Next workshop is at noon on July the 1st, at 12 o'clock noon at Main Stage. And our next regular meeting is on July 17th, 2023, here at 6 p.m. Is there anything else that needs to be brought before the commission? If not, I'd entertain a motion to adjourn.
So moved.
Second?
Second.
All in favor?
Aye. Aye.
We are adjourned at 6:20.